All right, good morning and happy Thursday, everyone. We're going to go ahead and get started. As a reminder, this meeting is being recorded. If you weren't with us last week, you might notice a couple of changes. Mainly, we've disabled cameras and microphones. The main reason is we want to respect students' privacy and want to acknowledge that many of you are dealing with students coming in and out of your offices. And so since we are posting these on YouTube for folks to watch later, we don't want any accidental students popping in on cameras or mics left unmuted, which might pick up sound from conversations. So if you do have questions at the end of the meeting, you can continue to utilize the chat, or if you raise your hand, we'll go ahead and allow that mic so that you can ask your question out loud. Today's agenda, we have announcements. We'll do our quick COVID-19 update. We have a guest presenter who's going to talk about vaccines, and then Mariana is on again today to give a monkeypox update. Here are the announcements, largely a repeat from last week, but we know many of you are on fall break. So welcome back. Want to make sure that you hear these announcements. There are new bivalent vaccine boosters available. Crystal is going to go into that a little bit more detail. We also want to let everyone know that Narcan is available for all schools. After announcing this last week and a letter that went out, we have been getting more requests for Narcan, which is great. If your school still does not stock Narcan and you're interested, please reach out to us and we'll go ahead and get you set up with the team that helps distribute the naloxone and can offer training for how to administer. We also have presentations that are available for staff, also any families that might be interested in learning more about the rise in fentanyl and what they can do. There is a presentation this afternoon facilitated by MAD. This also has to do with fentanyl, so you're welcome to share this meeting. It will be virtual by Zoom starting at 5:30 today. We also wanted to let everyone know of a new program offered by Pima County Health Department. We are looking to boost our facilitator pool for youth mental health first aid instructors. So if you know somebody who would be an excellent trainer in this curriculum, go ahead and share this registration link. We're hosting an info session later this month. People can learn about what it means to become a trainer, what the commitment is like, and what resources are being offered through the county. In addition to that, we also have QPR suicide prevention trainings. We've partnered with La Frontera, and so they are offering to come do those QPR suicide prevention trainings with school staff, and you can schedule a time that works best for your staff, and the registration link is there on the slide. Getting into our COVID-19 update, not a whole lot of change. We did see a pretty significant dip in our case rate, although our test positivity rate continues to be above 10%. And so you'll see that our transmission rate remains high. In terms of our vaccine rate for those who've received at least one booster, we're still at 50%. We're just kind of hovering there. We're not seeing a lot of movement there on that statistic. Here's our map, looking nice and green on our side of the country. Not a whole lot of change here, but this is looking really nice. This slide for you to kind of look at later goes into how these community levels are determined with the information for Pima County. Of course, this information should be updated later today on the CDC website, and we encourage everyone to bookmark that page so that you can continue to monitor this as the new data comes out each Thursday. Here's a look at our community transmission. Things kind of continue to change. We're seeing some improvement on the west side of Arizona, but the eastern counties are kind of continuing to regress back. They were looking yellow and orange, and now we're seeing more red. Some of the yellows went to orange. Pima County hasn't changed. We've been red for quite a while. That's it for my part. Want to let everyone know these resources haven't changed, but you can still request a vaccine clinic through our vaccine equity team. And then we've included links to all of the other resources we have for COVID and for monkeypox as well. So I'm going to stop sharing my screen. I'm going to invite Crystal to speak a little bit more about vaccines. And then when she's done, Mariana's going to come on and talk about monkeypox. Crystal, if you're here, I'll go ahead and turn it over to you.
Good morning, everybody. Let me work on sharing my presentation here. 1 second, please. Okay, does everybody see that?
Yes, we can see it.
Awesome, thank you. So I'm Crystal Rambo. I'm the Vaccine Preventable Disease Program Manager for the Health Department. So I just wanted to get on and very briefly talk about the bivalent boosters that just got approved for younger age groups, and just give a couple of other general updates as well. So I'm sure you all have heard that the bivalents to get approved for a younger age. So it's 5 and up now can get a bivalent booster. So what we mean by bivalent is that it covers against the original COVID-19 strain and also against Omicron BA4 and 5, which were and have been prevalent for quite a while now. So we are encouraging everybody who it's been more than 2 months since their last vaccine to go and seek this vaccination, since it does provide a broader range of protection. And they did push this approval through, hopefully in time to fight what we're expecting to be the winter surge. So it's kind of good timing for everybody before the holidays to get vaccinated if they're eligible. So this is right from the CDC, so it is available for anybody who wants to look at it. It shows a schedule for people who are not moderately or severely immunocompromised. There are some changes for those individuals, so that would be something they would need to look at. So I didn't post this here for everybody to look at and necessarily really memorize or really sort of figure out anybody's individual eligibility. It's more just for general awareness. Because at this point, the COVID schedule has become relatively complicated. So generally what I'm really telling people right now is that if you think you're somebody who probably needs a COVID vaccine, it's been a couple of months since you had your last one, we're pretty much just encouraging everybody to go see a provider. Rather than try and look online or try and sort through what it is that you need to get at this point, we really want everybody to just go and be seen, mostly because we don't want people possibly misinterpreting and thinking maybe they're not eligible or it's not time for them and miss an opportunity to be vaccinated. We would much rather them go see a provider or come to one of our offices and just kind of see what's going on with their general immunization status, rather than miss that chance to be vaccinated. The other reason is that a lot of people right now are due for flu shots. So in general, most people who are out there, unless they know they've been vaccinated in the last couple months, probably need something. So just make sure to encourage all your students and staff to go be seen and just see what they're due for at this point. But it is 2 months between either your primary series or your last booster to be able to get the new bivalent booster. So just a couple other general updates. I mentioned flu season. We all know that flu shots are especially critical for our younger children, but also important for all ages. So just make sure that we're always encouraging families to get their flu shots, and that if they're in for regular school immunizations, that if they get offered a flu shot, to please take them. They're safe. They're a great intervention for preventing hospitalization and death around this time of year due to flu. We have heard, we never know, of course, what the flu season will be like, but we look at flu trends based on what happened in the Southern Hemisphere before us, since they have their flu season first. And they did have a more severe flu season this year than they've had in the last few years, which we think a lot of that is due to people changing their behaviors, not doing the social distancing as much anymore, not masking as regularly. So just to be aware that we are anticipating more flu activity this year. So we want to be especially encouraging to everybody to get vaccinated. I know you all know that immunization data reporting season is here. The health department is here to assist you with those if you need help or have questions. I know it's been in the same online format for a while now, so most people are pretty familiar. But if you have any questions or you need any assistance, please let us know. We can look at that and help you with that if needed. And my contact is at the end of this presentation. The state is reporting that in general, school vaccination coverage rates are down. I'm sure you all are also aware of that. It's more across the state of Arizona. There's statistically significant decreases in coverage. Pima County, those decreases are less noticeable here. We have generally pretty good vaccination coverage and better than a lot of the other counties. We're above average for the state, which is great. But it is definitely something to continue to be aware of and to really try and discourage, especially the convenience exempting. We know people do that just to kind of avoid dealing with getting vaccinated, and we want to try and avoid that as much as possible. We know, of course, there are people who will always get exemptions, but if you believe that the family's just doing it sort of out of convenience, we want to make sure to try and continue to discourage that. The state does have data about they have more in-depth data than what they put online for what comes out of the IDRs. So if you ever have questions about that, I can connect you to that individual that has all that data if you're interested. One thing that they did bring up at our immunization conference this year is that schools that have a person who typically is tasked to work in a front office or in an administrative capacity, if they are responsible for the IDR, they tend to have lower coverage rates. And they think that's because those people tend to wear a lot of hats and are very, they have a lot of different tasks. And so it can be difficult to do all that extensive follow-up that's required for IDR completion. So just be aware that if you are a school or you know a school that is using a front person to complete the IDR, if you think they need more support, please let me know and I can assist with that. And that was it for me. This is my contact information. Email is probably the best way to reach out to me if you have questions. I think that's it, unless anybody has any questions for me.
Well, Crystal, thank you so much for hopping on today and sharing a little bit more information. If folks do have questions about vaccines or anything related to Crystal's presentation, we will be sharing these slides out in our follow-up email later today or tomorrow. Thanks, Crystal. Mariana, if you're on the call, you can hop on up. All right, perfect.
I am. Okay, so hello everybody. I will begin sharing my, wait, I need to move this first. And now I need to share this one. Are you able to see the monkeypox update first?
Yes, we see the first slide.
Super. So I know you're stuck with me and with monkeypox, and this time I added some more information because I really think that we need to begin being a little bit clear of what is happening, not only in our community, but in the rest of the world. And this information comes from the CDC. The link is at the bottom. You're going to receive the PDF just in case you want to track and receive this. And if you remember, maybe when we did the first monkeypox presentation, you will see that before looking at the confirmed case, that the numbers are really high. We can see the difference in the confirmed case that there are more than 72,000 cases in locations that have not historically reported monkeypox. And if you see in the next one, there are 109 locations that are reporting monkeypox now, and 102 has not historically reported monkeypox. So this is how bad the spread is, and this is actually something that we now expect, sadly, because we move too much. Remember the migrations before, it took years. It took years from the Europeans to get into by the Silk Road. The history teachers are going to be happy with me because took months or years to go to China and come back to Venice through the Silk Road, Marco Polo and everybody. Now you take a plane and you're there before the end of the day. So it's really important to know that. So this is actually also, the orange dots can show you places that has not historically reported monkeypox, and the blue ones are the one that historically had reports. If you remember, we talk about this area of the west clade and then the eastern clade. So we have results on several cases that has been tested at CDC from Pima County that our strain, at least circulating, is the west strain from this area. And you can see the size of our dot in the United States. We are counting a third of the world cases. So in the United States, now we have more than 27,000 cases. And you can see also that Arizona is in the more than 500 cases already reported. And this is a map from CDC, and the link is down there too. So for us, what is happening in Pima County, and I don't know if you remember, but we had been really low in cases. We are grateful about that. We have 127 cases reported, and we have confirmed 36. We have 24 probable, and that means that we're still having 60 cases only, what is really good. We have these 2 suspected cases and 65 that has been not a case. So that's kind of where we are on the reports from MedSys. And I have shown this before. The idea here is to show a little bit the gray are not a case, but you can see how the awareness on the medical providers comes, and so they begin suspecting and seeing more things and testing more. Those are good news for us. We prefer to have a lot of cases that are not a case, knowing that everybody is trying to test and looking for it. And we have a higher possibility to actually find the real cases. So in the epi curve so far, it looks like we went out of the peak, and now we need to look at what is going to happen. Is this thing going to stay? Maybe some of you have heard that New York already classified as an STI, a sexual transmitted infection, but not CDC. And this is more an administrative idea, because when you have a sexual transmitted infection, a new one, you will have more resources to try to put more control and especially prevention. And that's kind of the idea of New York classifying monkeypox as a sexually transmitted infection. As I said before, is not the common thing, and we are not there yet. So this is what we're seeing. Hopefully, at some point, this portion will not show more cases, but we will see. Maybe next year we will still be talking about this and going into our second year, and then we will see if it stays with that, it's become endemic. It's like to be continued, like the movies. Now, the most important thing, I'm going to delete that first. Week 42, this is our week 42. This week 42 goes from the Sunday the 16th to this Saturday the 22nd. Again, as I have been repeating, no school age monkeypox cases in Pima County. We had situation that already, it has happened, like not too many times, but it has happening, and it keeps happening. So people call here to say, or some nurses from school, I have a report. The mother said that the kid has monkeypox, but in 2 days they can come back, and they have a note from the doctor that says, oh, the kid can go back to school on Monday, but it doesn't have a diagnosis. So if you suspect any case, those cases, any suspected cases, should be reported and investigated. So monkeypox is still under the emergent and exotic diseases regulation. So the school nurses, you can provide contact information to public health, and we can follow up to know what happened. I had one case that I follow up, and the mother said that the kid had monkeypox, and it was actually Coxsackie virus, hand, mouth, and foot. And I talked with the provider, and she was like, no, I never even say monkeypox. I said chickenpox, and maybe the mother got confused. And those things happen. So we know that it happened. So it will be very, we can help, but we cannot help if you don't if you don't report the case. So you can, and you should, under the emerging and exotic disease, especially if you need help to confirm. Now, anyways, there was also questions on protocol. What will need to be done to go back to school after monkeypox infection? So the first thing that I want to be very clear is that you can have a suspected case of monkeypox. Monkeypox is difficult to report. It doesn't look like the typical thing. It's very easy confused with chickenpox. That is an absolute different kind of virus. So suspected cases must be tested. So the first thing, please, if a mother or somebody reports that the kid had monkeypox, we're not talking really maybe too much in high school, but we have had this information from elementary school. Like, oh, my son, the doctor said that has monkeypox. Okay, ask if they were tested, because they need to be tested to be confirmed. So if that happened, we should have the result. So if you tell us, hey, this person reports monkeypox, or you report the case to us and it's not in MedSys, instead of reporting, we will need to begin checking to see if it's not a case. Okay, so, but if they are confirmed, we should have the information. If you suspect any case, the first thing is that they should go home. They need to seek medical evaluation, to be tested, and wait at home until they receive test results. Even if the doctor said, no, this is, I don't think so, but I think it's chickenpox, but we're going to test anyways. That last sentence means the kid needs to be waiting for the results of the test at home. So if the tests come back negative, then discuss alternate this diagnosis with the medical provider. And the medical provider can send can send the note saying, okay, this is he's going to be non-contagious after 3 days of antibiotics or whatever it is, so he can go back on Monday. But if it is positive, nobody that is positive for monkeypox can go back to school unless they are absolutely free of lesions. So they need to stay in isolation until all lesions have scabbed and have lost the crusts. And under the crust, you have this new pink skin that shows where the lesion was. That's the time when the person can go back to school. And only if every lesion is okay. On the school is a little bit like congregated settings in there. So if somebody has a lesion in their hands, for example, it will be really, it will not be recommendable that they just cover and go. It will be better to really stay out. These could make an exception on adults, but kids with sharing things, you really don't know what could happen. So those are kind of answering what has been happening in this week here in the EP, that we have received calls from schools saying the mother said it's monkeypox. The other thing that I want to remind you is that about the expanded eligibility for vaccination in Pima County. And we discussed last week that any person, first of all, that we increase the timeline from 14 days to 12 months. So if in the last year somebody has new STI diagnosis, has a sexual contact with more than one person, if they had been, they have a sexual partner that had a new diagnosis of STI in the past 12 months, all of those are risk factors. So if you have an STI, you can also get monkeypox because it's behaving like that. So also, if you have been in contact with someone who has monkeypox, the possibility that you encounter another one could be. So it's better to get vaccinated. And anybody that thinks that could experience any of these risks. So if all, you need to be inside these eligibility criteria to be able to go to any Pima County clinic, call and ask for the vaccine. And always remember the vaccine, it's 2 doses. We have a couple of mass vaccination events here. The one on the 15th, that was last Saturday, was canceled. The next one is going to be the 29th, and we're still on it. And if there is any other news, we will let everybody know. But with the vaccines, and Crystal has been fundamental on this thing, that all the vaccines are pre-positioned in our clinics, so you just need to call and ask for an appointment to get the monkeypox vaccine. The other thing that is interesting on the eligibility is that now finally this pre-exposure prophylaxis has been open for persons in certain occupational exposure risk groups. So mainly the lab workers who routinely handle the monkeypox specimens, and healthcare providers who work in sexual clinics, STI clinics, or in settings that are primarily serving the LGBTQIA plus communities. So, so this is the best or the most important thing that we can do to control the disease is getting vaccinated. Prevention is the kind of the key, and on public health, that's why we work in here in this.